One of the goals in public health or epidemiology is to assess the health status of the population or measure the health of the people, how healthy are they. And this is can be performed by different indicators. Without knowing the health status of your population, who are they, and how what are the causes of diseases or morbidity, what are the causes of mortality, so we cannot provide relevant or appropriate healthcare services. So it is important to have an idea about some indicators which are used for measurement of health. At the end of this lecture, the student should be able to know or have an idea about indicators for measurements of health and classification of these indicators such as fertility, mortality or morbidity indicators, and he should know how can he calculate these indicators. The population studies are important in many aspects. Such studies are important to form a basis for supplying health services and health manpower. Without knowing who is your population, what is the composition of the population, is it young population, elderly population, and what are the type of diseases or morbidity, what are causes of death. So it is important to know this information in order to provide relevant, effective, or appropriate healthcare services or programs. One of the indicators, or there are a group of indicators. The first indicators are fertility indicators. This include first the crude birth rate, which is defined as the annual number of live birth per thousand population per year. How many live birth was given per 1,000 of population in a specific place in a specific period of time. And it is calculated by the number of live birth divided by number of total population multiplied by 1,000. To be more specific, another indicator is used such as general fertility rate, which represents the annual number of live births per thousand women in the reproductive age group at the age 15 to 49. Some books mention the age 15 to 45 years. The numerator is the same, which is the number of live birth per year in a specific population, and the denominator is different. In the first one, we took total population, and the general fertility, the denominator is the number of women at reproductive age group. So it is equal to number of the second one, the general fertility rate, equal to the number of live birth divided by number of women at reproductive age group multiplied 1,000. To be more specific, in some countries they use the marital specific fertility rates. So it represents the number of annual live birth per year, how many live birth born each year, divided by married women at the age of reproductive age group multiplied by 1,000. So this is very specific when we confine the fertility only to married women. So also the numerator is the number of live birth, while the denominator is the number of married women at the reproductive age group between 15 up to 49 years multiplied by 1,000. It is important to know the fertility rate because it is important to know how many the number of children born every year, how many healthcare services should be provided for a pregnant woman, in order to improve the health status of women. Also, the natural increase rate, another fourth rate, which is the natural increase rate, and this is equal to the crude birth rate minus the crude death rate of the population to find out how much our country is growing. Usually, developing countries have a positive or high natural increase because of high fertility rate or because of a high crude birth rate, and so it will there will be an increase in the number of population. So there is a positive increase in the population, while in the developed countries there are either neutral or negative negative natural increase or low natural increase, or there is no increase in the population. This is because of the proper use or highly used family planning methods, and because of the family planning method which is used in these families. And if we see that there is an increase in the natural increase in birth in the developed country, this may be due to the immigration. So the formula of natural increase rate equal to crude birth rate minus crude death rate divided by 100 when the birth and rates are in per million. So the result is the rate of the natural increase in percentage form. In Jordan, the crude birth rate at the year 2019 was 21.48 per thousand, and the crude death rate was 3.9 per thousand people. So the natural increase rate equal to 21.48 minus 3.9 equal to 17.58 and divided by 10, so it is equal to 1.7%. So the natural increase in the population in Jordan, it is only 1.7%. It is dramatically decreased than the previous years. In previous years, the birth rate was much higher and than this one, and also the death rate was higher, but it is decreased now because of the improvement. There is reduction in the birth rate because of the widely used family planning method by now, and also the death rate is decreased because of the improvement in the healthcare services provided to the population. So the natural increase in the birth is decreased dramatically. The age composition of the population. It is important to know the age composition, how many individuals in each age group. Sometimes also not only age group, only composition, but also the sex composition of the population. So it is important to know the age composition of the population. This is for comparison between different countries and to know whether it is a developed country or a developing country. In addition, also to know the number of people in each age group in order to know what are the needs and health needs for each group, and the provision of appropriate healthcare services according to the age group. For example, if in this table we can see there are two populations, population A and population B. They are divided into different age groups, and we can it is displayed in percentage. So to know the percentage of each age group in each community, especially if you want to compare between two communities. So by just looking to the two populations, we can see that in population A, the children and under 15 years of age, they compose nearly 17% of the population, compared to the children in population B, where they are nearly 42 or 43% of the population. So this means that they are the higher number of children in population B rather than in population A. On the opposite side, we can see that the elderly people in population A, they are constitute about nearly 17% of the population, while in population B, they were only 3.7% of the population. So there is a small number or proportion of elderly people in population B rather than A. So by just looking for comparison, we can see that this is the or equal or this is representing population B representing developing countries where there is high percentage of children because of high fertility rate and a low percentage of elderly people, which is only 3.7. That means there is high morbidity and mortality rates compared to population A, where there is a lower percentage of children because of low fertility and because of a good healthcare services provided for people. So they have good health status. So large percentage of people they stay for older age group. So the elderly people constitute about or nearly 17% of the population. So the composition of the population, it is the age composition of the population is displayed in a table as a percentage, and it represents the number or percentage of different age group, and it is used for comparison, and it represents also mortality. It reflect the mortality and morbidity and fertility. So it is good and it is important for comparison and to assess the health needs by this population. So the age composition is it reflect the age composition, different age group at different percentage at different age group, and it reflects the mortality, fertility, and morbidity. So we can have a lot of information by just having the age composition of the population. So this is the discussion of the previous table, and we can notice that also the percentage of elderly people are different in two populations. So the differences indicate. So as we mentioned in the previous slide, it reflects the difference in mortality, morbidity, health status, a difference in the health services and socioeconomic status, maternity and child health services, and family planning provided to each community. What are the factors which affect fertility or determinants of fertility? It is divided either into indirect or direct determinants. The indirect determinants, such as the socio-economic status, the family income, education and occupation, culture variables, religion, beliefs and values, health services, maternity and child health services. So all this is regarded as the indirect factors which affect the fertility, because lower socioeconomic people they have low education, so they have a higher fertility. And also for cultural or family reason or for religious reason or beliefs, some families they prefer to have larger number of population, larger number of children because of religious reason. They don't use the family planning methods. And for cultural factors, they because of they are working in farmer and agriculture, so they also they need a large number of family to help them in the farm. The direct determinants, proportion of married women. What is the percentage of married women? The use of family planning services, contraceptive pill. Many women they use different types of contraceptive, so it is very important direct factor in determination the number of the family. Some women they use contraceptive for limiting the number of their family, limiting they wanted to have only two, three, or four number of children. Or some women, they use the family planning method for spacing between their children. They space between the birth or the children. Induced abortion, it is one of the prohibited in ethically and religiously, and it should be and medically, because it have many complications. But unfortunately, some women, they have the induced abortion, especially if they have unwanted pregnancy or unplanned pregnancy. They try to get rid of the baby by induced abortion. Lactational infecundability, some women, they have what is called natural family planning, because while they are lactating or during lactating, they have amenorrhea, and they have no ovulation, so they will no have a new pregnancy until they wean the child from breastfeeding. So this is called a natural family planning or natural contraception, and it is this may it also determine the number of children. Sterility, many people, they have make operation for their sterility, or there are natural causes of sterility of no for no of fertility infertility, sorry. Spontaneous intrauterine death, there are large number of causes of the death of the fetus inside the uterus. And the duration of fertile period, how many years the women remain fertile, and this is have large number of causes, and it is variable between different women. The obstacles for population control measure or to the use of family planning method. First, political and racial concern, as we mentioned. Some government, they like to have large number of children in their community, especially in those countries who have war, for example. And there are also racial factors who likes to have or cultural or religious factors which opposition, they have opposition to the family planning methods. High child loss, many there are large number of child loss. Many women, they lost their child or their children frequently because of, for example, hereditary diseases or hereditary factors or accident, or many factors which cause child loss. Rural agrarian orientation, as we mentioned, because of agricultural factors. Many families, they are working in the farm or agricultural, so they need to have large number of children, especially they prefer to have boys in order to help them in the farm. Low status of women in some societies, the women have low status in many countries, especially in the developing countries. So she have no choice whether to say to have she want to have children or not. So this is one of the causes of lack of the use of family planning method, because she don't have the choice to use or of the family planning because of the family or the culture. Uh, problems with the current contraceptive. There are a wide range of contraceptive, such as pills or injections or intrauterine or sterilization, or there are large number of methods, but they are not free from side effects. Many women, they have different types of side effects, so they don't like or they are inhibited to use the contraception. Legal, ethical, and religious opposition, as we mentioned, to the abortion, which is very effective fertility control measure. And in most religions, and it is ethically and medically and legally, it is prohibited. So this will regarded as one of the factors which opposed to abortion. Mortality indicators, there are large number of indicators. We are going to express some of these indicators by using this simple scheme to describe the mortality, especially in childhood up to the first year of life. For example, we mentioned the first one is the crude death rate. Crude death rate is the number of all death at all age group, both sexes, from all causes, from out of the 1,000 of the population in a specific period of time. So the crude death rate equal to the number of death of people at different age group, both sexes, due to all causes, from all causes. So per thousand population, so equal to number of death divided by the total number of the population multiplied by 1,000. And it is important to know how many individuals died each year in order to know the as we mentioned, it is used in the calculation of the natural increase of life, natural increase of birth. Um, Rates related to mortality, as we mentioned, we are going to display different mortality in childhood, especially up to the age of 1 year. The first rate we are going to measure is, or to estimate, is the stillbirth rate. The stillbirth is defined as as a term. Stillbirth is the fetus who born dead after the 28 weeks of gestation before and up to birth. So he born dead, and this is called a stillbirth. So the number of stillbirth mortality rate is the number of death of the fetus inside the uterus after 28 weeks of gestation, and that means he is delivered, died, and it is divided by the number of birth multiplied by 1,000. So this is the first one. We are going to discuss it later, and we discuss the causes. Then after delivery, we up to the age of 1 year, it is the period of infancy. This is the period of infancy from delivery up to the age of 1 year. So any death during this period, during the first year of life, it is called infant mortality rate. And this period of infancy is divided into two periods: the neonatal period and the post-neonatal period. And this is divided because the differences of the causes of death in these two periods. So the neonatal period is the period between delivery up to the age of 28 days of life, while the post-neonatal death, it is the number of death of the child or the baby after 28 days up to the age of 1 year. And also the neonatal period is divided into two periods: the early neonatal and late neonatal. The early neonatal is the number of death of the baby from birth up to the age of 7 days, while the late neonatal death is the number of death of the baby after 7 days or after 1 week up to 28 days. And some books, they mention 1 month. So this is the a quick explanation of this period, so it make it maybe easier for you to know these terms, and we are going to discuss later. Another one is the perinatal mortality rate. The perinatal mortality rate, if we are back to the previous slide, the perinatal mortality rate, the peri means around. So it is the number of death which is around the delivery. So it includes two periods. The first period is the stillbirth, and the second period is the first week of life, which is the early neonatal death. So the perinatal mortality rate is the number of death of the fetus after the age of 28 weeks of gestation, plus the death in the first week of life, which is the early neonatal death, divided by the total birth. So this is the perinatal mortality rate, is the sum of number of fetal death of after 28 weeks of gestation or more, plus the number of newborns dying under the age of 7 days of life or during the first week of life in a specific geographical area, divided by a total birth, which include the number of live birth plus the number of fetal death or stillbirth for a specific period of time, usually in a specific time, a specific year, and it is multiplied by 1000. So the stillbirth rate, according to the World Health Organization, for international, it is used for comparison and the number of babies born with no signs of life at or after 28 weeks of gestation divided by total birth. So the stillbirth, as we mentioned, number of fetal death after the 28 weeks of gestation, they show no signs of viability, no heartbeat, and no respiration and no circulation. So they born dead when they died after the age of 28 weeks of gestation, and divided by total birth, which is the number of stillbirth plus the live birth. The infant mortality rate, as we mentioned, it is the number of death of children during their first year of life divided by the number of live birth. How many babies born live? This is the denominator, while the numerator is the number of death of the children during their first year of life, and it is a very important and sensitive indicator for the comparison and the health status of two population, because it is stated that infants, they are more vulnerable or more liable to have or affected by any difference in the socioeconomic status or in the environment. So they are very important used or sensitive used in the comparison between two communities. It is divided, as we mentioned, into neonatal mortality, which is the number of death of the children or newborn during the first month or the first 28 days of life, divided by number of the live birth. So it is equal to number of children who died during the first week or 28 days of life divided by number of live birth multiplied by 1000, while the post-neonatal mortality rate is the number of death of the children after 28 days of life up to the age of 1 year, and they divided by divided by the level, so it is equal to number of children died after 28 days of life up to the age of 1 year, and divided by the live birth multiplied by 1000. It has been stated that they divided the infancy period into neonatal and postnatal because of the difference in the causes of death. For example, in the neonatal mortality, most important causes such as the traumatic birth or difficult labor, congenital malformation, and early infection, while in the postnatal period, most important causes such as infections or environmental causes or malnutrition or accident. Age-specific death rate. Age-specific death rate, it is the number of death of people at a specific age group divided by total number of that age group multiplied by 1000. So all the previous rates regarded as age specific because it is classified according to age. And also we can take it at any age group, such as for elderly people or geriatric people. The number of death of elderly people or geriatric people equal to number of death after the age of 60, or some books state after 65 years, divided by number of all elderly people at this age group multiplied by 1000. While the cause specific, the constant, it is either 1000 or 10,000 or 100,000. It is according to the rate which you are going to calculate. So age specific, sometimes they are used in 1000 or in 100,000. And also for the cause specific death rate, it is the number of death due to specific disease divided by the total population multiplied by 1000. And in the cause specific death rate, the numerator is the number of death due to specific cause. For example, number of individual died because of cancer divided by number of the total population multiplied by 100,000 constant. Maternal mortality rate. Another is the maternal mortality rate, which is the number of death of women. From its name, maternal mortality rate, it is related to women. So it is number of death of women due to causes related to pregnancy, delivery, puerperal period, divided by number of the live birth occurred in the population. So it is equal to number of death of women during pregnancy or delivery or after delivery, puerperal period, which is up to 40 days after delivery, and divided by number of live births that occur in that year in that population multiplied by 1000. And also it is one of the important mortality indicators also used for comparison because it is related, or it reflects the quality of appropriate healthcare services or antenatal healthcare service or maternity and child healthcare services. Case fatality rate. The case fatality rate, it can be regarded as a mortality indicator, and sometimes some books they mentioned that it is morbidity indicators. So maternal mortality, case fatality rate, it is the number of death due to specific disease divided on the number of cases of the disease multiplied by 100. So it is calculated or represented as a percentage. Number of death due to specific disease divided by number of causes, number of cases of all cases of that disease multiplied by 100. So it has the same numerator of the cause specific death rate, number of death due to specific cause, but the difference is in the denominator. In this type of indicator, the denominator is number of cases of that disease. So it reflects the severity of the disease, how severe is the disease or how fatal is the disease, and the effectiveness of the treatment. Also, it is used in the comparison between two institutions. So it reflects the effectiveness of the treatment. Sometimes the same individual with the same disease, and they are admitted to different hospitals or treated by different health centers or health clinic, but the outcome is different. So it reflects the effectiveness of the treatment. Morbidity indicators, we have two more important indicators for morbidity, which reflect the frequency of the occurrence of the disease, or it reflects the existence of reflect the existence of different type of diseases, and they are very important to know the causes of different health problems or different diseases, and what types of diseases we have in our community, in order to provide appropriate or relevant healthcare services according to the number of existing cases or and according to number of the new cases. So we have two types: the incidence rate and we have the prevalence rate. The incidence rate, it reflects the number of new cases of the disease. How many individuals will develop the disease in the community per this year from a specific disease. For example, how many individuals have coronavirus, COVID-19 in this year? They are new cases, so it reflect or it calculate the number of new cases. But in the previous, they mentioned that it is used only for epidemic or for acute cases, but also we can estimate the incidence, for example, of a chronic disease such as diabetes. How many individuals develop diabetes every year for the first time? So it can be used for the communicable and the non-communicable diseases. The incidence calculated in two types: either the number of cases or number of spells. For the first one is the number of new cases of a disease in the community divided by the total population multiplied by 1,000. The other one is the spell incidence. That means there are some diseases which occur frequently with different spells. For example, some people, they have a frequent flu during the year, or they have frequent gastroenteritis during the year, many spells of the disease. So especially in children, they have frequent attacks of respiratory tract infection or gastroenteritis. So they have spells of the disease. So each spell, it is regarded as one or a new case. So the spell incidence equal to number of spells during the year of a spell of a disease during the year divided by the total population multiplied by 1,000. The incidence is useful in the following situations. First, to study the disease of short duration, such as epidemic, or to study the frequency of chronic diseases, as we mentioned, or non-communicable diseases, to evaluate preventive measures. How good is vaccination in the prevention of occurrence of new cases, for example? So, or how good is the health education in improving the education of the people or awareness of the people to promote their health? How good is breast screening program in prevention of the disease or early detection of the disease? So it is good in determining the risk of acquiring the disease, to assess the transmission of infectious disease in an epidemic. The term attack rate, sometimes it is used instead of the incidence. They use the attack rate, which is mainly used in outbreaks or in epidemics. So it replaces the term incidence. So it is just the same. The prevalence rate reflects the number of existing cases of the disease. How many individual having diabetes this year? So, or how many individual having heart disease, hypertension, or coronary heart disease? They have already the existing cases. So accumulated cases, whether they are new cases or they are old cases. So if we want to estimate the prevalence, for example, of myocardial infarction for the year 2020, for example, so we start from the 1st of January 2020, and we see how many individuals already have the disease, registered cases. Then we are going to follow the people until the end of 2020, and we see how many people have a new cases of myocardial infarction. So the prevalence equal to the new cases plus the existing cases before we start the calculation of the prevalence. So the prevalence equal to the number of new cases plus the old cases of the disease divided by the total population in a specific period of time multiplied by 1000. The prevalence rate are useful for disease of long duration or chronic diseases, and it is used in administrative purposes because it is important to for the planning of the healthcare services. How many health services, how much, and what is the quality of the healthcare services. The prevalence is usually given in three types: point prevalence rate, and period prevalence rate, and lifetime prevalence rate. The point prevalence rate, it reflects, or it is the prevalence with respect to a specific point in time. For example, did you have an asthma attack on Monday, for example? So the existing cases, but we are going to take it at a point of time, and especially this is used in the cross-sectional disease. Or the period prevalence, which is related to the prevalence over defined period of time. Did you have an asthma attack in January, for example? And lifetime period, so how ever had an asthma attack. So it is usually as a prevalence, it reflects the new cases and existing cases. There is a relationship between the incidence and the prevalence. The prevalence of a disease may vary from place to place or from time to another because of the variation in the incidence and the duration of the disease. The most important thing, so how many cases develop the disease, for example, each year. But if an individual have a disease, so what are the outcomes of the disease? Either recovery or death. So the prevalence depend not only on the incidence, but also depend on the duration of the disease. If a disease have a short duration and the individual will recover quickly, so the prevalence will be low. But if the disease is also, so we have low prevalence in case of when the patient is recovered quickly or the disease is not fatal. So there is a short period of time, so the prevalence will be low. Also, if the disease is fatal, also the duration will be low, so short, so there will be low prevalence. So the prevalence first depend not only on the incidence but on the duration of the disease. If the disease recover quickly, so we have low prevalence. While if the disease is fatal, also we have low prevalence. But if the disease is not fatal and the patient can live with the treatment, with appropriate treatment or appropriate intervention for long period of time, so that means there is a long duration, so the prevalence will increase. So the longer the duration, the higher is the prevalence, and the higher the incidence, also the higher is the prevalence. So the prevalence depend only the incidence and the duration of the disease. So the duration of a disease is a function of its fatality or the tendency to recover. The higher the case fatality of the disease, the shorter is the average of the duration and the less is the prevalence. And similarly, the quicker the recovery of the disease, the shorter the duration is. So the relation between incidence and the prevalence depends greatly on the natural history of the disease, and also in the case of influenza, for example, in the case of influenza epidemic, the incidence is high, but not contribute too much growth of the prevalence because of high or spontaneous rate of recovery. In the case of disease that has low or zero cure rate, but where maintenance treatment or good intervention permit a sustained survival or increase the life, so then the incidence contributes to continuous growth of the prevalence. In such cases, the limitation of prevalence growth is the mortality which occur in the population, and there may be low incidence and high prevalence, as in diabetes, where the high incidence and low prevalence as for common cold. So these are the important comparison for diabetes. Even if we have low incidence, but we have high prevalence because of the good intervention and proper treatment for diabetes, so the patient can live for a long period of time, so there is high prevalence. While in common cold there is high incidence, but because of there is low prevalence because there is a spontaneous recovery and low prevalence. Apart from age, several factors determine prevalence. So, the severity of the disease, it may, if many people who develop a disease die within a short time, so the prevalence will be decreased. As we mentioned, also the duration of the disease. If the disease lasts for a short time, its prevalence will be lower, and if it lasts a long time, so it have a longer duration, the higher the prevalence, and also the number of the new cases or the incidence, the higher the incidence, but also determined by the outcome. So by just looking to the diagram, we can see, if we imagine that we have a pot and we put a lot of cases in that pot, so what is the outcome? The outcome is either recovery or the disease. So the prevalence depend on these two outcomes. So it depend on the duration or the recovery of the disease, or how fatal is the disease. So the factors influencing the prevalence, it is increased by longer duration of the disease, and it is decreased by shorter duration of the disease. The out migration of healthy people, of the people the healthy people migrate, so the prevalence will increase. And in migration of healthy people, it will cause a reduction in the population, while it increase in the new cases, and if there is high incidence, and it decreased by low incidence. Prolongation of life, that mean prolongation of life of the patient without a cure, and it will cause an increase, while it increase in decrease by high fatality. We have already discussed all these factors. In migration of cases, that means increase in the prevalence, and out migration of cases, it will decrease the prevalence. Improve diagnostic facilities, better reporting, this will increase the prevalence, and improved cure rate will cause decrease the prevalence. Since the prevalence can be influenced by many factors unrelated to the cause of the disease, prevalence studies do not usually provide strong evidence of causality. So, as a prevalence, it is not a good indicator used for measuring the causality of the disease. which is as compared to the incidence. Measures of prevalence, however, helpful in assessing the need for preventive action and need for healthcare services and the planning of health services. So it reflects the need for a good preventive action and the need for a good or a proper healthcare services. Also, the prevalence is a useful measure of the occurrence of conditions for which the onset of the disease may be gradual, such as type 2 diabetes or rheumatoid arthritis and other chronic diseases. The prevalence of type 2 diabetes has been measured in various populations using the criteria which are proposed by the World Health Organization. The wide range shows the importance of the social and environmental factors in causing this disease and indicates the varying need of diabetic healthcare services in different populations. Preventive measures might lower the incidence, such as vaccination or health promotion or by health education. So, this will prevent the occurrence of the disease. And whereas clinical interventions may decrease the duration or decrease mortality, resulting in an increase in the duration and then an increase in the prevalence, as we mentioned. Prevalence rate are generally used to describe the extent of the disease, how many individuals in the community having the disease, or it measures the magnitude of the problem, how much the problem in our community, whereas the incidence look at the rate at which new cases of the disease develop in the community. While the prevalence can be affected by how long people live with a condition, the incidence not take this into account. The incidence have no relation with the duration, while the prevalence is affected by the time. Prevalence is descriptive, often demonstrating public health need. As we mentioned, on the other hand, the incidence is useful for studying the causes of the disease or the etiology of the disease in order to prevent or propose a preventive measure to prevent the occurrence. Another important one, we have already mentioned the case fatality rate. We mentioned that it is one of the regarded as one of mortality indicators, and some people they use it as a measurement of the morbidity indicators, and it is mentioned we have already mentioned that equal to the number of individual died due to specific cause of a disease divided by number of all cases of that disease multiplied by 100, and it is expressed as a percentage, and it is reflect the disease severity, how severe is the disease, and availability, as we mentioned, of the effective treatment. It is used for comparison between two institutions when patients having the same condition admitted to two institutions and the different in the outcome. In the first hospital A, for example, if they have a case of typhoid fever in hospital A and another typhoid fever patient admitted to hospital B, for example. So if the patient in hospital B died because of typhoid, so it is either the patient with typhoid admitted to hospital B he has a severe case of typhoid, or because the management of typhoid in hospital B is not good. So this is used in the comparison between two institutions, or treatment in two institutions, or health services provided in different health institutions. The life expectancy. Life expectancy is another measure of the health status of a population. And it is widely used, and there are what is called it is reflected in or displayed in tables, and it reflects the health status or improvement in the health status, improvement in the health services in the population. If we have noticed the previous life expectancy table and compare it to the to the updated one or the new one, we can see there's large variation. That's why that where we can see that there is a prolongation in the life expectancy of people from the previous years. So it is important to compare the development and the health status of the population, or the health services in the population. So life expectancy is another measure of health status of a population. It is defined as the average number of years an individual of a given age is expected to live when and it usually it is estimated at birth. So usually in many books we see that the life expectancy at birth. So when an individual born, how many years is he expected to live? And this depend on the country he born. It depend on the health status in that country. It depend on the health services provided in that country. And there is a wide range in the difference. Sorry, a wide range difference or large difference in the life expectancy in the previous years than in it is now. So previously, for example, it was 45.6 years during the period in the 50s. And now it is in some countries it is reached between up to 65 years, and between the 90s and 2000, and now it is increased to the 80s. And it depends on the country and the male or female. Male and female have different life expectancy, where the females have higher life expectancy than males. So life expectancy at birth is an overall measure of health status, and it has been found that, as we mentioned, women live longer than men. Now in some countries they start to estimate the life expectancy at the age, for example, at 60 or at 65. So how many years the individual expected to live when he have the age at 60 or 65 years. So this is because, especially in developed countries, because they have a good health status and good health services, so people live longer, and they have longer life expectancy than in the developing country. And thank you.